Hello, everyone, and Yali Madat. Welcome to today's presentation on dealing with influenza during the COVID-19 pandemic. My name is Munira Premji, and I am so delighted to be moderating this session. I am an HR practitioner by profession. I'm also a cancer warrior and have battled 3 advanced cancers in 5 years. I've written about my journey with cancer in a book called Choosing Hope, One Woman, 3 Cancers. And my experience with cancer has really made me an advocate for healthy living, for taking care of ourselves, taking care of our bodies. And this includes taking care of ourselves during the flu season and during COVID. And today we have 2 extraordinary healthcare professionals that will lead the session. And I'm particularly excited to introduce them to you because I happen to know both of them. You will first hear from Dr. Sunil Varghese, who serves as the chair for the Aga Khan Health Board, Ottawa region. Sunil is an infectious diseases physician and the chief and medical director of the Department of Medicine at a local community hospital. He originally hails from Calgary and now calls Ottawa his home. Sunil does have an amazing wife, Hasina, and 3 precocious, curious, remarkable children who I've had the pleasure of meeting. I met Sunil for the first time about 4 years ago at a mutual friend's place, and I was privy to a number of different conversations that he was a part of, and I kept thinking to myself, man, this guy is just like so smart. And I got to tell you, he's also very, very busy. I just found out moments ago that he's actually leading this presentation from the hospital. So he went to the hospital today, seeing patients, running around, really busy day, and has taken a time out of his calendar while at the hospital to do this session. So thank you, Sunil. You will also hear from Dr. Anisha Lakhani, who lives in Vancouver. And Anisha earned her bachelor's degree in pharmaceutical sciences from UBC and a doctor of pharmacy from the University of Washington. She has extensive experience in clinical pharmacy in the acute care and ambulatory care settings. Her interest is in research and academics, and she's an instructor at UBC in their School of Pharmacy. Dr. Lakhani also has a long history of volunteering and serves currently on the Aga Khan Health Board BC as the access subject matter expert. Yes, the same access that we all know about since COVID. She's also the Pharmacy Network co-lead. I had the wonderful pleasure of working with Anisha during the Diamond Jubilee, and I was always struck by her infinite grace and her competence. And during the Diamond Jubilee, she served as major, and her leadership skills, came through loud and clear. And so I am so excited to be a part of today's webinar, and I look forward to learning from the 2 doctors with all of you on prevention strategies for influenza. In today's session, the doctors will cover a variety of topics, starting from what is influenza, who's at risk, side effects, reactions, types of vaccines available, how to prepare for vaccination. So really from A to Z. There will be a lot of content covered in the presentation today. And one thing that I ask is, as soon as you have a question, please immediately type those questions in the Q&A box. We will monitor all your questions, and we have allocated time toward the back end of the presentation to respond to as many of your questions as possible. So sit back, relax, enjoy today's webinar, and I will now invite the very busy Dr. Sunil Varghese to take us through the nuts and bolts of influenza, starting from what is influenza.
Thank you for that very kind introduction. I just made up a story about being at the hospital. I'm actually laughing because I'm pretty sure my kids are looking at my picture on the bio and laughing a lot at home. So thank you to them. And thank you all for having me today. My role in our webinar is to just set the framework for what is influenza and some of the background material for the vaccine and some prevention strategies, and to set the context of influenza in this era of the pandemic that we all are living in. And then from that, we'll actually get to the meat of the matter about the vaccines itself, not myself, but Dr. Lakhani. My kids and my family were mentioned, and one thing that is consistent in my house are questions. I always tell them, turn off the TV. Why? It's time to go to bed. What? So I figured what I'm going to do is just base this, my part of the presentation, on questions. And the first part is the introductory Flu 101. What is influenza? I think everybody has a sense of what influenza is, but just so we're all on the same page, it is a virus. It is a respiratory virus that causes the symptoms that are listed on the right-hand side of the screen. High fever, runny nose, sore throat, etc., etc. The virus is a little bit more nuanced in the sense that it comes in 3 different flavors: influenza A, influenza B, and influenza C. Influenza C is not significant clinically, causing mild symptoms, but influenza A and B is what we see both in throughout the world as the cause of the seasonal influenza outbreaks. And in the bottom right hand of the screen there, you can see the attack rate, which means the percentage of the population that is susceptible to influenza who will become infected with influenza at baseline. And that's depending on which study you're looking at, which population group you're looking at, 10 to 20%. The R naught, as we're probably all very familiar in the COVID environment of what an R naught is, but that's in the absence of any measure to prevent spread, what is the natural rate of spread? And that is about 1.1 to 1.5. In the United States, influenza causes a significant amount of hospitalizations, about 3 to 5 million cases, and the mortality is about 300,000 to 600,000 annually. These numbers vary depending on the study you're looking at, vary upon the year, because it's a little difficult to tease out what is influenza, what is the side effect of influenza, and what is a lung-related infection that's causing both the hospitalizations and mortality. So in the Canadian context, thank you, this is just to give us a snapshot of what's happening in Canada. On the left, in the map of Canada, you can see that different grays, different shades of gray. The darker it is, the more influenza there is. And it's not surprising that the 2 most populous provinces, Ontario and Quebec, lead the way with respect to the number of laboratory cases of influenza, followed by Alberta, and then the middle provinces in BC. This sort of mirrors what's happening in the COVID environment. You may not be able to see very clearly, but you can, depending on which region of the country you're in, you can see that there's a virtual even split between influenza A, the 2 types of influenza A that circulate, and the 2 types of influenza B that circulate in the community. And the right side of the screen is really to show us where the incidence and the peaks start. So week 1 right in the middle is actually January. And depending on the year and the season, you may get a peak anywhere from late November, December to as far out as March. It really depends on the circulation of that particular influenza season. So who is at risk? Pretty straightforward. Children under 5, especially those under 2, older adults, and by that I mean people over 65, 70 years of age, women who are pregnant, and people with certain health conditions. And we're not strangers to these health conditions. They're pretty much the classics: cardiac disease, pulmonary disease, diabetes, obesity. Those are the big ones that people with those symptoms who get influenza have a higher risk of hospitalization and unfortunately mortality. So those people are targeted. These 4 groups of people are targeted for influenza vaccines. In addition to them are the people who are in contact with these 4 groups of people. And that includes family members, it includes healthcare workers, other frontline workers who may come in contact with them. So what can I do, or what can you do to protect yourself and your family? And I put this about the slowing the spread of COVID-19 because these public health measures are virtually the same as they can be for influenza season. So face masks, keeping your distance, frequently washing your hands, and then not going out if you're feeling unwell. So these are pretty drilled into society right now, given the fact that we're living and experiencing the COVID pandemic. But this is the mainstay of preventing influenza. And this is the flu vaccine. And this, you've heard a lot about it. And we're starting the flu vaccine season, and which is why so many of you have joined us today, presumably to learn a little bit more about the flu and the background of it. So what is the flu vaccine? So I'm not going to get into what vaccines are, but essentially, vaccines are just a way to stimulate your immune system. So when you are actually exposed to the disease of interest, your immune system is quote unquote primed to deal with it, thereby either preventing the actual infection or mitigating or minimizing the symptoms from that infection. And this slide is pretty busy, but it's broken up into 3 things. The first is the boxes at the top. And what you can see there is that there are 2 strains of influenza that we're particularly concerned of, influenza A and influenza B. To be particular about it, it's actually 2 types. Those can be broken down into subtypes and lineages, depending if you're talking about influenza A and B, and they can be further broken down into groups. Each season, the WHO, in conjunction with a number of health partners in the world, come up with what are the 4 strains that are likely to be circulating that pharmaceutical companies should build and target their vaccines towards. I'm giving an example of the strain below, where it's named by the type of influenza, A or B, where it was first isolated, so in this case, Sydney, the strain number, the year it was isolated, and the basic subtype. And just to digress a bit, influenza A comes in 18 different subtypes, but for a human context, only 3 are of importance. H1, H3, those are the big 2, and then occasionally H2. We hear about other H types, but really it's H1 and H3 that are the predominant strains that have been circulating since the big influenza epidemics of the early 1920s, the Spanish flu. As a result, what happens is that the WHO releases the strains that should be in the vaccine components, and there are a number of vaccines that are developed. And these vaccines can be based on really 3 broad categories. First is the coverage. Some vaccines cover just 3 strains. So influenza A strain times 2, so both 1 for H1 and 1 for H3, and 1 influenza B strain. Some add a second influenza B strain, allowing 4 vaccines or 4 independent strains to be covered. The production can differ. The vaccine itself can be the whole virus, which has been inactivated. It can be the live virus, which has been adapted to grow in the cold, and therefore, when placed in the body, doesn't cause infection, but is enough to stimulate the immune system. It can be subunits of the vaccine, or it can be the antigen, or the A, which is then broken up and split, so we only see small proteins of it, which are enough to stimulate our immune system. And then the third component is the delivery. We can have the regular vaccine, we can have live vaccine, and then we can have high dose vaccine, or those that are adjuvanted. And by adjuvanted, I mean another substance is added to the vaccine to further stimulate the immune system to get that immune response that we're looking for to protect us going forward. So this really encapsulates the time frame of how vaccines are created. Now, this was for the pandemic, so the numbers aren't, the timelines aren't exact, but the concept is the same. So the pandemic was the 2009 H1N1 pandemic that arose. So the first thing that happens in month 1 is that we have to identify which virus strains are going to be included in the vaccine. WHO has to prepare the vaccine strains and the reagents. They have to verify it. And that entire process can take anywhere from about 3 to 5. Then it's released to the individual manufacturers of the vaccine, who then have to grow the vaccine. They have to manufacture it. They have to do their tests to make sure that the quality of the vaccine is appropriate. Then, once that has been achieved, then they have to go and actually mass produce the vaccine and release it. Altogether, the entire vaccine development process takes anywhere from about 5 to 7 to 8 months, which is why the vaccine that we're going to get this year is really based on information that was from the end of 2019, early 2020. So this process has a couple limitations. First and foremost is that the vast majority of vaccines were egg-based, meaning that the vaccine strains were actually grown and developed in eggs. There's a number of technical reasons for that, but because of that, there's some limitations to that. One, it takes a long time. Two, actually getting the quantity of eggs. And three, sometimes there's problems where the vaccine may slightly mutate in the egg itself. This has been overcome by new processes to develop vaccines, which are cell culture, meaning that they're using actual organism tissue. The most common one is actually kidney cells, recombinant antigens, and synthetic vaccines, which we're not quite there yet for influenza. The cell culture has been approved since 2012, and my understanding is that the 2021 is the first one where one of the vaccines will actually be produced in that way. Recombinant antigens is pretty much a synthetic way of developing vaccines, and only one is in play in the United States. It's not available in Canada, to the best of my knowledge. Regulatory approval, it does take time to make sure that the reagents are clear, and then of course, each of the companies that are producing these vaccines have to get them approved by the various health authorities in the countries themselves, and that can take time. Worldwide availability. So part of that is not every pharmaceutical actually makes the vaccines. Sometimes there's problems in the production process, and sometimes there's disruptions. And so that's why in certain years, there's been a delay in the rollout of the vaccine or the amount of vaccine that we can get at a specific time. More specifically, one of the big problems is the efficacy of the vaccine, particularly in the elderly population. The elderly population's immune systems naturally start to decrease. And as a consequence, they may not get the robust immune response that we're looking for with the vaccines. So vaccine companies have come up with different ways to do that, which includes increasing the dose of the vaccine and using the adjuvant to stimulate the immune systems. And then one of the big problems with the influenza vaccine is the lack of cross-reactivity, meaning that because of slight changes and mutations that occur in the influenza virus over the course of a year, the vaccine that was used last year will not work as well as it should in this year. Therefore, the vaccine process has to be repeated over and over and over again. Pharmaceuticals are looking at ways to produce a truly universal vaccine, which becomes independent of that drift, which we'll get to shortly. So we've advanced ourselves. Flu 201. Why did I still get sick? And so this gets to the concept of what is vaccine effectiveness. And you can see in 2015, the vaccine effectiveness was much lower. And that's for a few reasons. One is the nature of the influenza virus, that antigenic drift. So I've alluded to the fact that the vaccine is a living organism to a sense, that it responds to what's happening out there, and the genetic material, the genetic information can change, which causes slight changes in the proteins that the vaccines are based on, therefore not making it as effective when it was first designed. There's issues with vaccine production. So sometimes, and this is a rare process, admittedly, is that genetic changes can occur in the vaccine development process, particularly with the egg-based. There's also issues with the host immune response. So as I mentioned, the elderly don't have as robust an immune response as people, in their 20s. And so even though they get the vaccine, they may not be getting the antibody titer that someone who's younger. But all of that to be put aside to look at the first point, which is The point of the vaccine is not just to prevent the flu, it's to decrease the hospitalizations, and most importantly, to decrease morbidity and death associated with the flu. And the data is quite clear that even if the effectiveness of the vaccine, which is defined by the number of cases of influenza, even if the effectiveness is not as high as we would like it to be, it still results in decreased hospitalizations, decreased morbidity, and decreased death. So, side effects. There's a number of, shall I say, smaller side effects, which I don't want to minimize, but they'll be discussed later. But there are two serious side effects that have been associated with the influenza vaccine in some ways incorrectly. The first one is Guillain-Barré syndrome. In 1976, there was a late winter pandemic strain of H1N1 where a vaccine was created suddenly. And from that vaccination lot, there was an increase in the occurrence of Guillain-Barré syndrome, which is a neurological disorder. However, subsequent vaccines have not shown any increased risk. That being said, the producers of the vaccines and the government regulatory agency have been very cautious because of what happened in 1976, and they put a recommendation that if you have had Guillain-Barré within 6 weeks of a vaccine, that it becomes a contraindication. But I want to point out that the risk of Guillain-Barré is very small. It's 1 per 2 per 1 million doses of the vaccine. And further, I want to point out that the risk of Guillain-Barré due to the influenza virus itself is 1 to 2 per million. So in short, what I'm trying to say is that the data after 1976 has not shown any increase of risk for Guillain-Barré due to the vaccine, but because of what happened in 1976, it is included in the product monographs and when we do the screening for who should get the vaccine or who shouldn't get it. The second serious side effect is something called ocular respiratory syndrome, which again is a very rare occurrence. And this is essentially you get red eyes and respiratory symptoms within about 24 hours of getting the immunization. And it can be divided into mild, moderate, and severe. And I've shown this chart here just as an example of the workflow that people will go through to decide whether you should get the vaccine again if you've had ocular respiratory symptoms in the past. And what I'm hoping this shows for people out there is that, yes, you can actually get it again if you've had mild to moderate. And even if you've had severe, there is a pathway to make sure that you're safe to get the vaccine again. And again, I want to emphasize this is an extremely rare occurrence. Now, moving up higher level, what has been the impact of COVID-19, or what will be the impact of COVID-19 on the influenza season? This is somewhat unpredictable, but two broad issues occur. One is clinical, and the second is what is the impact of public health initiatives on influenza. And under the clinical, there's clinical overlap and co-infection. The symptoms of flu and the symptoms of COVID-19 can in some cases be virtually indistinguishable. And you can see cough, fever, fatigue, muscle aches, etc., are features of both. The point I want to highlight is if you have these symptoms, you can't attribute it to being the flu, and you can't attribute it to being COVID-19. The only way to understand what's happening is to get tested. And so that's my urge for the group here, is that if you do have symptoms, please get tested. The second thing I'd like to say is they don't have to be isolated. You can get the flu and you can get COVID-19 at the same time. Early on in our COVID-19 pandemic, some of those cases were occurring. As you recall, the early cases in the United States and some in Canada started to happen in March, April, which is the tail end of our flu season. But with our public health measures, we don't really see the full impact of co-infection, though early data has shown that sometimes it's worse in being co-infected than it is being mono-infected. The second impact of COVID-19 has been the public health measures. And I show this as a real success story because this is a complicated slide, but what I'm getting at is the dotted lines that you see are the natural history of influenza in these countries. So we're looking at Australia, Chile, and South Africa. All of them are in the southern hemisphere. But with the onset of public health measures of masking, hand hygiene, and social distancing, influenza cases came down. And that's a tremendous success. It really is a real life success story and real life example of how powerful those three actions can be. So translating that to what's going to happen to our influenza season, we don't know. But what we do know from this data is that we need to continue doing those basic public health measures, and we have to be more diligent given the fact that not only are we dealing with COVID-19, but the potential of influenza. Now, these public health measures, while excellent, have thrown a little bit of a wrinkle because, as I alluded to earlier, our influenza vaccine is based on what happened in previous times, particularly in the southern hemisphere. And because the cases were lower, we don't have as robust data as we would like as to what vaccine strains will potentially be circulating in our community. And that is the second impact. The second impact of COVID in terms of the public health measures is the availability of the vaccines. So production may have been decreased in some of the plants internationally. Number two, which results in a decrease in availability of vaccine. Number two, there may be a huge uptake in the number of people actually getting the vaccine. The target is 80%. We're typically nowhere near that, but this year may be special. So there may be difficulty accessing the vaccine when you want to. And number three, and this will affect us on a day-to-day basis, is before we used to have vaccine clinics. We can get a number of people in public health units, at pharmacies, at your physician's office. But now with COVID and the onset of social distancing, making appointments, screening tests, actually getting the vaccine, a little bit more effort and a little bit more planning on our parts. Yes. So the final exam. And the question is, I didn't write the question, but is, should you get the vaccine? And it's a resounding yes, an absolute resounding yes, with the small little pharmaceutical caveat of assuming no contraindications. And why? Well, your own personal risk, the risk of your loved ones. And one thing I just want to take a minute to focus on is that our obligation to each other. I think many of you are aware of this quote from Hazrimam. I'm not going to read it to you, but please take a second to read it. And what it highlights is how interconnected we are. We all kind of know this, but COVID-19 has really shed light on how truly, truly connected each one of us is. And I want to take a moment to recognize all the people who are suffering from COVID-19, not only those who have been infected and have become sick or passed away, but those of us who had suffered because of our work situation has changed, our social situation has changed, our mental health has suffered, the uncertainty that we're all going through. As a clear example, even our access to the Jamaat. And I think that all of us should keep that in mind, that we're all suffering so we can save our health system for those who truly need it. And if we can do little things to help each other, to participate in this, and to help all of us collectively overcome, then I think we have an obligation to do that. That includes adhering to the masking, adhering to social distancing, the hand hygiene, and then layering on the influenza vaccine to help us protect each other, to protect our families, and to help society as a whole. So with that, I'll leave it at there. Thank you very much.
Now that Dr. Sunil has given us a crash course in influenza vaccine and tested us all, and we've all said, yes, we're going to do the vaccination, it's my job and my pleasure to prepare you on how and when you should get your vaccination. So in my section, I'm going to be talking about the types of vaccines that are available in Canada, who is eligible for free vaccinations, who should not get the free vaccinations or vaccination in general. What are some of the concerns about allergies and common side effects? How should you prepare for your vaccination day? What should you do to look after yourself after you've had your vaccination? And when should you go see your doctor? Dr. Sunil mentioned the influenza virus strains that are going to be common this year, anticipated to be common for epidemics. The flu vaccines that are available this year in Canada contain all of what you need. The influenza type A, H1N1, influenza type A, H3N2 that he mentioned, and the two influenza type B. So there are 10 different products available through different manufacturers, and these products come in 5 different types. Most of them are inactivated viruses, and each one of the province has different type of vaccination, all because they need to be shared through the provinces. So when you go to one province, they will have a different product compared to another province. But these vaccines are all effective, and as I mentioned, they all contain influenza A and influenza B. So the most common one is inactivated influenza trivalent, which is effective for most population. The inactivated influenza trivalent adjuvanted one is the one that has a little product in there that gives a little kick to the immune process, and it may be preferred for people who are over 65 years of age. Then we have the quadrivalent vaccines, and some provinces carry just those. And particularly good for the children because these are the vaccines that focus influenza B infections. But anybody can take quadrivalent vaccines. Dr. Sunil mentioned the high dose, and the high dose is going to be available mostly for select population in all the provinces for the residential care patients. The live attenuated vaccine is available in only a few provinces. BC is one, and Quebec is another one. The live attenuated one is administered intranasally. It's easy to give it to the children. That's the advantage for the live activated intranasal one. There are limitations to who can get those live vaccines, and we'll go through that in the next few slides. If your province doesn't carry the live vaccine, you don't need to worry about it because the other vaccines are just as good. So when you go for your vaccination, this is a table that's showing just a few of those vaccines. There are mostly inactivated viruses, vaccinations in most of the pharmacies and doctors' offices. The live attenuated one is available for children, so some clinics will have that one, and the pharmacies will have that as well in some provinces. So when you go to the clinic, 1 or 2 of these will be available. When you fill out your consent forms and you talk to them about your risk factors, a product will be chosen appropriately and you will be given the vaccination. You need not worry about whether it contains a preservative or not. Your consent form will be enough to inform the pharmacists, to inform the doctors on the correct choice of the product. So who is eligible for free vaccination? Free vaccination is available in Alberta, Saskatchewan, Manitoba, Ontario, and Newfoundland to anybody over 6 months of age and older. The other 2 provinces, British Columbia and Quebec, free vaccination is available to certain high-risk population, and Dr. Sunil has mentioned who they are. Children mostly that are 6 months old to under 5 years of age in British Columbia, and in Quebec, it would be 6 months old to 23-month-old. Older adults, 65 years old and 60-year-old and over in Quebec, all the healthcare workers, frontline workers will get free vaccination. If you are in any one of the high-risk groups, such as if you have diabetes, COPD, asthma, certain types of cancers, you will be able to get free vaccination. If you live with somebody that has these conditions, if you're visiting somebody in facilities that has high risk, if you're living with somebody who's pregnant, you will be able to get free vaccination. There are some other groups as well. In each province, there's minor differences. But most of us will be able to fit into one of these categories if we are living with somebody or we are visiting anybody that is a high-risk group. So who should not get the flu vaccine? Babies don't mount or do not benefit from vaccines if they're under 6 months of age. But they still need to be protected. That means that anybody around babies under 6 months of age should get the vaccination. The moms, the dads, the grandparents, visitors, aunts and uncles that are visiting the babies need to keep them protected. So you should go and get the vaccination for their protection. Dr. Sunil mentioned the Guillain-Barré syndrome, which is rare, and for the purpose of mentioning it, it's a contraindication if it was associated with the flu vaccine. And again, the chances are very low that you would be fitting that category. If you've had a life-threatening anaphylactic reaction to influenza vaccine the last time, and you had serious side effects, you had serious rash, difficulty breathing, you fainted, and you needed epinephrine, you'd know that you had anaphylactic reaction. You would not be getting flu vaccine this year. But there are very few people who have experienced anaphylactic reactions. Anytime you have questions about specific cancer therapies, whether it's a checkpoint medications, some other treatments, check with your specialists. They will have advice. Do not assume that you do not need vaccination. You could be eligible and you should be getting vaccination. So ask your professionals. If you're seriously ill, wait until you get better. If you have asthma, exacerbation, wait until you're better. But do not forego getting your flu vaccine. It's important that you do later on. For the provinces that have live vaccinations, there are some contraindications. The contraindications are that if you're taking certain biologicals, certain chemotherapies, you don't take live vaccination, you take the inactive vaccination. What if you have allergies? There was a time when egg-based manufacturing process had such a higher amount of egg protein called ovalbumin that people were reacting. People who have egg allergies were reacting. This year, the amount of ovalbumin is very low. The public health officials have indicated over and over again, you need not worry about egg allergy. And particularly, if you can have egg in baked products, scrambled eggs, then you really need not worry about egg allergy in any vaccinations. Particularly in the influenza vaccines, they are reassuring us that you do not need to worry about egg allergy. Latex allergy, well, the syringes and all of the rubber products in the vaccine does not contain natural latex. That means that you should not react to latex allergy. But you do need to inform people that are taking care of you not to wear latex gloves and do not apply any bandages that contain any latex. You need not worry about the vaccine itself having any latex in it. Okay, so common side effects. Majority of people do not have a reaction, and those that do, they have mild and limited side effects. When the side effects occur, they start within 6 to 12 hours and they last 1 to 2 days. Sometimes the side effects are telling you that yes, the vaccine is working. So it's not something to fear. We will tell you how to be prepared. One way of looking at side effects is like lottery. If the chance is 1 in 20 that you'll get any one of these side effects, you may. It may not be that severe. I remember buying lotteries in my hospitals for 30 years. The chance of winning was 1 in 20. 30 years, I never got my big house or my big vacation. I don't want to minimize the side effects. Yes, you may get them, but I'll tell you how to be prepared. These side effects listed here are quite mild, but do watch to see if they're getting worse. Let's look at the next list. These are the uncommon side effects: dizziness, cough, body rash, upper respiratory tract infections. These are things that you want to watch for regardless whether you have a vaccine or not. But few days after the vaccine, do keep an eye on your children or anybody else, just to be ready to deal with these side effects. The rare reactions. Dr. Sunil has informed us what to do with these, that they are rare. Oculo-respiratory syndrome comes in mild, moderate, and severe. A lot of people do get sick after the vaccination. Some people are sick for a few days. We don't want to minimize those side effects for people who get them, but it should not stop you if they're mild. If they're severe, talk to your doctor first. So how do you prepare before you go for your vaccination? We know that there are waiting lists. So make your appointments with your pharmacies, with your doctor, with your healthcare units. We know that families are going together. Book your appointments. You may have to wait. You may have to wait in a line. You may have to wait outside the clinic or pharmacy. You may have to wait in your car. So go when your time is right. A lot of mobile apps are using SMS notifications. So if you're in the car or you're waiting in the coffee shop or outside, you can go in when they're ready for you. Don't let these things stop you from getting your vaccination. Know that this is an important thing to do and preparations are being made to accommodate you. There will be COVID-19 pre-screening at every place. Take your health card with you. Be prepared to talk about your allergies, medical conditions, your medications, because there will be a product selection happening when you provide them this information. Don't forget your mask. Use hand sanitizer. Take a dose of Tylenol with you. It always helps. And take the dose again in 6 hours after your shot. How do you prepare your children? Remembering that the children have a high attack rate, they are back in their schools. You want to prepare them for the vaccinations. We're going to give you some do's and don'ts. Be calm. Use your normal, calm voice. Children are very sensitive to your own reactions. If you're nervous, they're nervous. Use matter-of-fact supportive approach. Describe how it's going to feel as pressure, squeeze, or poke when you get it. Explain to your children why you need your vaccination, telling them that you need to take it to stay healthy and that you will be getting the medication in your arm with a needle, or you may be getting the medication in your nose. In each nostril, you'll get a small spray, and then we'll be done. What you don't want to do is use words that will focus the child's attention on the needle. You don't want to give them false reassurance that it won't hurt, because it may hurt. And instead of apologizing that, hey, I'm sorry that you have to go through this, provide reassurance, help build some resilience in your children. So these are the tips that help children, but I think they also help grown-ups and everybody else. So tip number 2, deep breathing. Breathe in for count of 5, breathe out for count of 5. Repeat that until your vaccination is over. Hey, I learned breathing again from a colleague, and I'm very thankful that I've done that. Deep breathing really helps. Distraction. This works very well with me. Books, music, games. Give the children something to be distracted by if necessary. Tip number 4, numb the skin. There are products that are available from the pharmacies. If you're going to need that, you need to buy that product ahead of time. You need to apply it 60 minutes prior so that it's already working. So choose your arm, is going to be the left or the right. Apply the numbing agent. Have it ready 60 minutes prior to going. Then you're good to go. Once the vaccination for your child is over, Recognize their effort and tell them how happy you are. When you get to the clinic or the pharmacy, what do you expect? You have to expect best practices during the time of COVID. We know that the pharmacies and clinics are ready, but if you see that they're not practicing best practices, point it out. Personal protective equipment is going to be worn by vaccinators and all the staff according to the regulations in every one of the provinces. There will be safe distancing, privacy area for vaccination. There will be pre-screening, consent forms. Post-vaccination, there's going to be an observation area for people to watch you, the vaccinators to watch you. Again, this is by law for 15 minutes or up to 30 minutes. All of the vaccinators are trained. We are trained to give you any treatment that you need, whether it's epinephrine or dimenhydrinate. Very rare. I've hardly had to use it myself, but we do watch everybody and we are ready and we are trained to provide treatment if need be. Lastly, protection of your personal information is a must and it is an expectation wherever you go. So, how do you treat your symptoms? If you develop any side effects, you need to be ready. Starting today, big question. Do you have a thermometer at home that actually works? Check your medication cabinet. Check for everything that you need today. After the session, make sure you've got your cough drops, you've got enough honey, you've got your Tylenol, whatever it is that you normally use for side effects, have it ready. Make sure that if you have any cough syrups, decongestants, that they are in good date. Keep these handy for this upcoming flu season. If you develop any symptoms in the next few weeks or months, you're not nervous. You've got everything ready and you're ready to go. If you have nasal congestion, irrigate your nasal passages using saline solution. And this helps so much to keep the sinuses clear. It avoids the use of a lot of antihistamines and decongestants. If you do need antihistamines and decongestants, use them. Don't go through the suffering. If you have sore throat, gargle. Gargle with warm water, gargle with salt water, gargle with turmeric. Be ready to treat yourself at the first sign of sore throat. If your family members are using humidifiers, bring them out, clean them up, have them ready. Make sure you have enough cough drops. For fever, any child under 18 years of age, we recommend not to use aspirin because of connection with Reye's syndrome. Use acetaminophen for fever. We know a lot of people that have fever and they talk about it and they say how many side effects they have and they're sick for days, but they do not use acetaminophen. Use it every 6 hours, get rid of the fever. It's when you cannot get rid of the fever that you should go to the doctor. So take your vaccination and take acetaminophen for muscle aches, pain as well. When do you see your doctor? You see your doctor if you develop any of these severe symptoms. If you have difficulty breathing, shortness of breath, if you have high fever, severe cough, green-yellow sputum, pain or pressure in your chest. If you're vomiting often, there are some people, children and elderly, or people with cardiac diseases or cancer, if they vomit a lot, they can become dehydrated really quickly. So you want to go to the doctor when these things happen. Anybody pregnant who develops severe side effects or severe symptoms of flu down the road, they need to go see the doctor immediately. Anybody that has asthma, heart disease, cancer, you have severe side effects of the flu, go see your doctor. If your symptoms get better and then afterwards they get worse, go see your doctor. Reinforcing what Dr. Sunil said. These are everyday things to do, so continue doing them. Stay home when you're not well. Don't touch your eyes, nose, mouth. Clean and disinfect frequently, cover your cough, safe distancing, wear your mask, wash your hands. When you do these things, the spread of the virus is already going to be minimized and everybody will be safe. If you have questions, don't wait until next day, until your doctor's office opens or your pharmacy opens. Every province has 24-hour helpline. Use that line. Having said that, we're happy to tell you that the Access Jamati Services is ready to take calls about flu vaccinations. The volunteers behind the scenes are our healthcare providers themselves, they're nurses and other professionals who are very well versed about flu in their province. What are the products that are free for them? Are they going to be able to get free vaccination in their province? What are these vaccinations? If you have any complicated questions, these volunteers will refer you to the medical team that also works behind the scenes to answer some of the tough questions. The pharmacy network leads are also lined up in the Access Jamati services for you. If you have any specific questions about which pharmacy can I go to, mine is busy, is not taking anybody, how can you help me? If you have any particular questions about medications, the pharmacy leads in every one of the provinces are there in the access lines. We're very proud of these volunteers that are working with us. Now that we have finished our presentation, we will have some poll questions, which we will turn back to Munira to lead us to these questions.
Hello, everyone. So we do have some poll questions and we'd love for you all to participate. And so the first question is, what percentage of the general population received the vaccination in 2019? And you have 4 responses. If you could please put in your best guess. Okay, and Anisha, do you want to respond to the audience
Yes,
comments?
yes, Dr. Sunil and I did a little bit of research on this, and the correct answer is 42%. So while we are expecting 80%, it is 42%, and last year actually was higher than the previous years. So this year, we're hoping that it will be a little bit more. Remember that there is limited supply of the flu vaccine, so do try and go as early as you can. Our responses are pretty good, Munira.
Yes, very good. And we have a second question for you. And that question is, how many Canadians reported serious adverse reactions to the influenza vaccine in 2019? And you have 4 responses. So put in your favorite guess. All right, and the responses are 19 of you. Well, let's see. 36% say 19, 34% say 190, 30% say 1900. So what is the correct answer, Anisha?
The correct answer is 19. That's very, very few reported serious adverse reactions. Did you know that the vaccinators, the pharmacists, the doctors, the nurses that are doing the vaccinations are obligated by law to report serious adverse reactions? We have to report them. It's important that we are informed that these are happening. If you do get serious adverse reaction, you are hospitalized. You can tell your doctor or your nurse or your pharmacist to report it. We have an obligation to report. So there were only 19 reported, and chances are that there were a few more than 19, but it's not that high.
Well done. And so now we have a third poll for you. And the poll question is, what would be one reason you would not take the influenza vaccine this year? And you want to select one of the following. You feel you don't need it, it'll make you sick, you don't have transportation, you can't afford it. And the fifth answer is, you will take the flu vaccine this year. So we have 6% who say you feel you don't need it, 12% who say it'll make you sick. And then we have a whopping 82% who said, I will take the flu vaccine. Anisha, your comments.
Munira, this is amazing. We have heard in the past and read in many statistics that people who listen to their physicians or seek advice from physicians are more likely to get their vaccinations. So big kudos to Dr. Sunil's presence here today, and for all the audience to be listening to us today to give us that answer. In general population, when the surveys are done, the answers are a little different. 40% say that they will take it, and 40% say that they will not take it, and 20 is undecided. So this is actually a very, very good poll, and we're really happy. Sunil, any comments?
Yes. When I was a kid, like many of you, if I came home with a good mark, my parents would say, "What about the other 10%?" So, so it's a very good response, but I'm looking at that 6%, and we will talk after.
All right. You know, we have almost come to the end of the presentation, and there were a number of questions that came up. So for those of you who have to leave at 9 o'clock, feel free to drop off, and I thank you for participating in today's webinar. We had about 160 people, and so really thankful for you to have made the time to do this. But for those of you who can stay for a few minutes longer, I will ask a few questions, and doctors, if you could keep your responses pretty tight, that would be amazing. And the questions are, does it matter where I get the vaccine, whether it's the doctor's office, pharmacy, Shoppers, Drug Mart, or other grocery store pharmacy? Does it matter?
I will answer that, Munira. The training that has gone into to get the pharmacists ready, I can talk about that. It's a very intensive training. And so I'm very confident that the pharmacists will do an amazing job. And they have been doing it for many years now. And since the pharmacies opened up their services to vaccination, the vaccination rate has actually gone up because of convenience as well. So
Okay,
in my opinion,
so the answer is really you can get your flu vaccines anywhere
exactly,
with certainty.
exactly.
Perfect. Here's another question. Can you get a flu shot in a province that is not your home province or province of residence? A yes or a no answer would suffice.
Yes, every province has it posted on their website. If you're visiting, you can get your flu shot there. As long as you're a Canadian citizen, take your healthcare card with you, you will get it.
That's a great answer. Hopefully that answers your question. Here's one. I have been recommended to have a high dose vaccine, but my pharmacy is not ordering these. So where else can I go for it?
So you would call the public health and find out which location is carrying it and go there.
Perfect.
And yeah.
Amazing. Here's three different individuals who asked the same question. And that question is, are there different dosages of flu vaccines given to those age 65 and over versus to younger folks?
So the dose is standard. It's 0.5 ml in all of the vaccines. There is one vaccine for pediatrics. It's 0.25 ml. So the doses for everybody else is 0.5. So it's not bigger than that for all the 10 vaccines.
Okay, very good. Here's one. Here's one that's an interesting one. It says, please define herd immunity.
Sure, I can take that one. A herd immunity, easily defined, is that enough people in the community are immune or have already been exposed to an infection to therefore prevent further transmission of that infection. And the percentage that's required depends on how effective that infection is in spreading.
Okay, thank you for that. Dr. Sunil, here's another one for you, which is, how does the World Health Organization know which type of virus are circulating each year to develop the vaccines?
Yeah, it's very complicated and actually very impressive. What happens is that there's international surveillance of the vaccine that occurs in a number of sites, and all of those sites feed into local regulatory agencies, which then feed into the WHO. And there's an expert panel and a report that's produced a couple of times a year for the vaccine strains for the South and a vaccine strain for the North.
Mm-hmm. Brilliant. Okay, here's another one. Who decides which vaccinations we get?
Is this provincially or individually in the doctor's office, or maybe I can answer both.
Sure.
We
Yeah.
talked about the manufacturing process and how challenging it is, and that there's limited production in every one of the facilities. So when these are produced, each province gets assignments according to their jurisdiction. And then there's a selection process. For example, in British Columbia, there's a few that are available, and the public health decides the distribution of these, and then the population is vaccinated accordingly.
I will just add one thing, that nationally, each country will have a regulatory body or a governing body, and ours is called NACI, who provides guidelines on an annual basis of vaccines or any updates based on research that's been occurring in the previous year.
Okay, that's really great. And two more questions. I think we're getting to them very quickly.
Take your time. Yeah.
And the question is, I received the vaccine before Thanksgiving. Would this be the fall 2020 vaccine, or would it be from last year?
This will be the new vaccine.
The new vaccine. Okay, I'm sure that the listener will be very happy to hear that. I think we actually covered them all. So I just really want to say, thank you to everyone who joined the webinar today. We had about 160 people who participated. So thank you for your time. And I want to thank the doctors for great content and presentation on how to manage our health during this time, and for taking questions and for taking time out of your busy, busy life to prepare the slides and to facilitate today's session. The flu season is always tough, and the flu season during COVID makes it particularly challenging. So our hope is that you will prioritize your health during this time and consider all the valuable recommendations from today's session. And finally, a shout out to the health board, the webinar team, the communications team, the technical folks behind the scene for making this webinar happen. It really takes a village, and you guys are shining stars. So have a great rest of the evening, everyone, and Yali Madat.
Thank you, Yali Madat.